Hi, I'm Dr. Corey Wilson here at Meadowmont Dentistry. Thank you for joining us again today for another short video. For today's video, I wanted to cover a couple of myths or misconceptions that come up quite a bit. So the first misconception, or things I hear a patient say all the time, are, hey doc, I don't really eat a lot of sweets or desserts, so I know I'm probably not going to have any cavities, I'm probably okay. Well, unfortunately that is not true at all, because the bacteria that cause cavities, and actually even gum problems as well, they don't care if you're eating Mountain Dew and Snicker bars or whether it's pasta and bread. Either way, the simple sugars that those things break down into, the bacteria are going to live and thrive on. So it doesn't matter if you're eating a lot of sweets or not, you can get cavities from almost anything that you eat. So second myth, let's dive into bleeding gums. I also hear patients say all the time, well, my gums bleed a little bit, doc, but that's probably not a big deal. I don't feel, I feel pretty good. Unfortunately, that also is definitely not true. So bleeding gums are absolutely not normal. Bleeding is a sign of inflammation, potentially some infection there. And keep in mind, those bacteria can very easily get into the bloodstream, cause all kinds of problems, and have been linked to things like heart disease, certain kinds of cancer, diabetes. Actually, the list is quite long. Myth number 3. I hear this all the time. Doc, I feel good, none of my teeth hurt or are sensitive, so I'm great. Do I even need an exam today? Actually, yes, you definitely need an exam today, because unfortunately, cavities and gum problems, unless they get really bad in advance, oftentimes have no symptoms associated with them at all. So, you could have a cracked tooth, a bad infection, and even though you would think that that would be pretty uncomfortable and be very obvious, it's just not the case. So what are the solutions then? How can we avoid some of these pitfalls and issues? Now, you probably already have guessed what I'm going to say, but I'm going to say it anyway. So regular dental visits. Please come in, get your regular checkups, cavity check, x-rays. Let me take a really good look. Let's make sure everything is okay. And then finally, we've got to be doing a really good job with an electric toothbrush and a water pick, or maybe some of you actually do have a really good floss routine, so instead of a water pick, that's fine. Again, the kind of toothpaste you use, the mouth rinse you use, some of those things really don't matter that much. But if you've got a great electric toothbrush and you're using your water flosser, or your floss really well and consistently, then that's 90% of the battle at least. Guys, thank you so much for joining us today. Again, just wanted to dispel a couple of myths and misconceptions. Thanks for joining us. I'll see you next time.